Hi, Steve from Wandsworth Physiotherapy. Two of the most common skiing injuries that I see are as follows. The most common is ACL ruptures. So ACL is a ligament inside the knee, this ligament in here, and it's typically injured when there's some kind of twist or fall or impact when you're on the slopes. Now, people typically will describe hearing or feeling a pop inside the knee. It will be extremely painful to begin with and difficult to weight bear. However, you may quite quickly be able to move around reasonably normally on it. However, it will swell up very quickly within an hour or two, and there may be episodes where it actually gives way underneath you and you collapse on the floor. So if this happens to you, then come down and see a physio. They'll be able to assess the knee and see whether the ligament is intact. If they feel it's not, and having listened to that story, they will refer you on for an MRI and we can take things from there. If you did need surgery on the knee, there's lots of physio you'll need before surgery to get your knee nice and strong. The second most common injury would be injuries to the shoulder. Now, it can be dislocated shoulders and it can be fractured shoulders. Now, if you have either of these things, you need to get yourself to the local hospital where it will be x-rayed, assessed and treated for you. If you do dislocate your shoulder out on the slopes, put it in a sling, get yourself down off the slope and get into hospital. Don't try and relocate it on the slopes. There are lots of important blood vessels and nerves that run through your armpit, and a poor relocation attempt can actually damage those structures. And if you have a fracture, you're going to need to be in a sling, and you're going to need some physiotherapy after both of these injuries, probably sometimes for a couple of months, to regain muscle strength and range of movement.